Stop TB is a campaign phrase that has been used to curb the spread of the disease in the country and globally. The silent disease has now claimed more than millions of lives. That's why on the Health Beat this week, we focused on people living with TB in the period of the coronavirus pandemic. It is another clinic day at the Ruiru Sub-County Hospital in Kiambu County for patients living with tuberculosis. It is a step of faith taken by Nduta, not her real name, who was diagnosed with TB May this year. Before the diagnosis, Nduta had undergone several misdiagnoses that culminated to a delay in proper diagnosis.
I started having an intense coughing. Then I went to have a medical checkup, and I was told that I have bronchitis. But then even after taking medication, the coughing persisted.
The greatest fear the mother of one had before going for the intense checkup was the similarity in symptoms she exhibited with COVID-19, a condition that saw her colleagues maintain a safe distance from her.
Some people were scared of me when I was coughing, because now they don't know you're coughing from what. Whether it's corona, whether it's something else, they don't know. In fact, nowadays having a cold is a trauma because you don't know what it is.
Her treatment journey started soon after. Luckily enough, her family has been supportive, with her sister now living with her daughter as she recuperates.
I try as much as I can, and when I'm going out of the house, I'm always in mask. Sometimes I even wear 2 masks, to make sure I'm not contagious to other people.
People living with TB have reported significant challenges in accessing medical services during the coronavirus pandemic and associated lockdowns. Difficulty in finding transport to access healthcare, changes in TB services, and fear of contracting COVID-19 during a health facility visit were cited as the key barriers in a recent report by Global Civil Society and TB-affected community.
The only way we can beat any disease, be it HIV, be it COVID, be it TB, is number 1, to have information about it. Number 2, to seek care. So if you feel that you have cough, you have fever, you're losing weight, that you have difficulty in breathing, that when you produce sputum it has some blood, or things like that, just go to a health facility, ask your clinician, I want a TB test.
Lisa, not her real name, is another patient who was confirmed to be TB positive less than 2 months ago. Lisa, who has been living with rheumatoid arthritis for more than 12 years, did not show common TB symptoms before her diagnosis.
Nilikuwa nina lose weight. Na sikuwa najaribu ku lose weight. I was not trying to lose weight, but I was constantly losing weight. So I went to my doctor, and he'd carried some tests, and nothing showed.
Her fear was contacting COVID-19 or anything worse than that, given that she has a pre-existing condition.
It was tough. It was tough now going to the hospital then, because I went now, that problem was at its peak during when the COVID was at its peak. And I had to go to the hospital, and I had to go through the COVID testing because I could not be admitted for that procedure without having gone through the COVID testing. And the waiting was a bit scary. You see, you're in the hospital, you don't know what the result will come out, will you be sent to quarantine, and all that.
According to Polycarp Kariuki, Ruiru Sub-County TB coordinator, TB and COVID-19 have similar symptoms, a situation that poses a great challenge to community health volunteers conducting contact tracing for TB as well as follow-up for patients under their jurisdiction.
What we normally do, we have a system where we have the community health frontiers who helps to do what we call contact tracing. If we get a patient who is having TB, they visit the home, they ensure that the members of that family are screened for TB, and those who have TB, they are treated. Again, the same community health worker ensures that those patients like those who miss to come for treatment, they are forewarned to ensure that they come for the clinic.
TB is a preventable disease, and despite this, it still kills 1.5 million people per year worldwide, making it the top infectious disease killer. Even more concerning is that there are people living with latent TB, which has no symptoms.
For the extrapulmonary TB, we have a challenge in patient knowing their condition early. There is a delay in the diagnosis of extrapulmonary tuberculosis.
According to Dr. Lorraine Mugambi Nyaboga from the Center for Health Solutions Kenya, health facilities have experienced cases whereby patients fail to show up when they are referred to labs for TB tests, with many fearing the stigma that comes with the disease.
Passive case finding. So,
according to the Ministry of Health TB program, there were about 156,000 people with the disease in the country by 2018, but nearly half of all estimated cases were not diagnosed, notified, or treated. In the meantime, the country is relying on active case finding as a strategy to curb the spread of the disease.
So active case finding is whereby any patient visiting a health facility is screened for TB regardless of what brought you to the health facility. So you may come to a health facility, you had a broken bone, you fell, you sprained yourself, or you feel like you have malaria. You know how people say, I have malaria? A healthcare worker will ask you, are you coughing? Do you have fever or hotness of the body? Have you noticed night sweats when you sleep? Like when you go to bed, do you notice that you're sweating a lot? Have you noticed some weight loss,
TB is an airborne bacterial disease that is fifth killer in Kenya. A 2016 prevalence survey, the second after the first in 1957, revealed the burden of TB in Kenya was at 426 cases per 100,000 population. The Health Ministry had then said that this was more than twice as many TB cases as previously estimated. Experts say if nothing concrete is done soon to mitigate the disease, the silent killer will claim more lives through misdiagnosis and late treatment. Diana Rose, K24 for the Health Beat.